Hello, I'm Dr. Jihan, and welcome to Raising Resilient Minds. Today, I am excited to introduce a guest who I've actually known for quite some time, and I'm really excited that she's able to join us today. Dr. Jalelah Abdul-Raheem works full time as the Department Head of Nursing and Allied Health at Redlands Community College and part time at Southwestern Oklahoma State University as a graduate adjunct instructor. She's been a registered nurse for 15 years with clinical experience in adult and pediatric medical surgery, home health, and case management. She's been in nursing education for the past 13 years. She currently holds certifications as a certified nurse educator, board certified cognitive specialist, and a certified healthcare simulation educator. She has recently founded and is the CEO for J. Atifa RN Support Services to equip families and professionals with the tools to identify triggers, develop proactive strategies, and gain control over challenging situations through free resources, expert guidance, and education. She has published 2 books: her memoir, Unexpected Experiences Beyond Autism, and the resource companion, Unexpected Experiences Beyond Autism, to serve as a resource for those she plans to serve within her business. She loves spending time with loved ones, exercising, traveling, and reading during her free time. Welcome, Dr. Abdul Rahem.
Thank you for having me.
One of the things that we want to dive into is just what are some of the different aspects and things that can play a role into making sure that children live their best lives. So my first question for you is, when you hear the term resilience, what does it make you think of? It could be something from your past or just something that you're currently doing.
I would say if we talk about something from my past, it's just the desire to keep going. No matter how hard it is, no matter how low you get, you just keep going. And then when you make it on the other side, you realize that you developed a different type of strength that equips you for the next challenge. Currently, in my situation, especially with my son, I feel like we both have developed quite resiliency just through the obstacles that we face together. It equips me to use different strategies with him and stay a little bit more calmer and sound. And then it helps him with his confidence of knowing, that things will get better.
Definitely, I understand that. What are some of the things that you already kind of went into a little bit of that, but so resiliency means we're giving you some, you've been given some tools or things that help you to be a little bit more flexible, right? And so what are some of the tools that you feel like you've instilled in your own child or any of your clients to help them build resiliency?
I would say patience. I've had to learn that myself. Patience with yourself, grace, allowing yourself to make mistakes and know that that's a learning experience. I would say also consistency. That's one of the biggest things that I've worked on with myself, my clients, and my son, with just continuing to do better and try over and over again.
So as a busy mom, how do you go about being consistent?
Well, to be honest, that is very difficult. It is very difficult. I have always been one of those people. I'm typically very structured, and I attribute a lot of that to just the fact that I was one of those people who went through my education pretty much straight through. So I've always had some type of schedule, and I just got used to that. So I try to maintain that same type of structure at home with my son. It does get very challenging, especially the days when I'm tired or feel like I don't necessarily want to adhere to it because I just want a break. But I realize that he thrives based on that consistency. So we have calendars and visual schedules all throughout. There's things like that that keep us structured. I even have his chores on a schedule when he exercises on a schedule.
Can you go into that a little bit more? So how do you do the schedule for the chores and exercising? Like, how do you set that up?
So we map out this calendar together because I incorporate him with everything now. Before, when he was smaller and he really didn't have the tools to really contribute, we didn't do it as much. So now I allow him to just kind of come up with what he feels like needs to be in his schedule. So I just start with whatever his school schedule is, or now his summer schedule. And I typically take a few weeks to transition them in if we're going to make any adjustments in it. But when we get home, I give him an hour of downtime. So if we make it home, say about 4, I give him downtime until about 5. We typically do dinner about 5:30. And then after our food digests about 6:30, we do about a 30-minute exercise. And I allow him to pick out whether he wants to do like one of a sonic video on YouTube or one of those movement videos, or we'll go for a walk. Sometime I'll take him to the gym that's close to us that he's allowed to go into. And then after that, he has his chores. About 7 o'clock, he'll take the trash out, maybe fold his clothes or wash the dishes. And then about 7:30, 8 o'clock, he does his medicines, takes his bath, and then he wraps up and gets ready for bed. So it was one of
That's
my
great.
ways to kind of minimize electronics. So
No, and I love that because the reality is that once they get stuck on electronics, it's very hard to get them off of it, and then it creates drama and chaos in the household when you say get off of them. And so I love that because what many people don't understand is that not using electronics right before bed is actually one of the best ways to help a child and adults fall asleep. And so that's actually building, those tools of resiliency because he doesn't have to now fight with you about, getting off of something that's giving him this constant stimulation and making his brain just very excited. So I like that you're incorporating the exercise in the evening, which will also help him to, release lots of good hormones and things like that for his brain, but also hopefully make him a little bit more tired when it's time to go to bed. So that's pretty good. So, you were inspired to write this book. Please share a little bit about it with us.
So my memoir, Unexpected Experiences Beyond Autism, was something that I honestly did not envision myself writing. I have journaled since I was a child. That's just one of my biggest outlets. And so I just had gotten to a point where I just felt very isolated in my experiences with my son. There was very little support. I tried a few support groups, but the majority of them were in person, and you couldn't bring your children, so that just didn't work for me. And so with my busy schedule of working so many jobs, pretty much met a breaking point, and I just woke up one day and I said, I'm going to, you know, start a virtual support group. I thought about that, and then I thought about, well, one of the things that's going to come up is me telling my story. And that came with a lot of anxiety because I'm a very private person and I didn't quite know how well I would communicate that to the public. So I just started taking the things that I've journaled and I just wrote. I was advised by a very close friend of mine to just write until I couldn't anymore and everything just flowed out of me. I had no clue about how to go about a book writing process or anything. So it was kind of on the fly, but I connected with the publishing company that my former supervisor had actually used, and they walked me through, and that's how my memoir came into fruition.
Wonderful. Congratulations. So if you want to share, a brief synopsis for our listeners of, what would they expect from this book and to kind of get out of it.
Okay. So you can expect from this book a very raw experience. I did not really filter a lot. I wanted the public to really feel the emotion, the feelings of being overwhelmed, and really get a good insight into what it's like raising a child with special needs. It's one of the things that we really don't talk about. So I wanted to give readers a perspective of what that looks like and what it looks like not only for the parent, family, friends, and the child, along that journey, and it being more than just the diagnosis, whatever that may be. My son, he has several. Autism was the first as far as a disability diagnosis. So I just wanted to give them that perspective. And then I also wanted to share things that I learned because there were a lot that I've learned from experience. And thankfully, I have the professional background to kind of help with some of that. And so I was very fortunate enough and blessed to have that, and no understanding that not everyone has that. So I shared a lot of things that I learned along the way in different phases, and a lot of resources that I used in hopes that it would help someone else along their journey.
That's wonderful. Now, one of the things, your with your son having these multiple diagnoses and things like that, and acting out in a lot of behavior issues. How do in our culture, right? In African American culture, it's often you just spank the kids, but when you have a special needs child, that's not helping at all. And to be honest with you, it's not helping most kids. Spankings really aren't doing anything for them because they're not able to communicate their feelings. They may not understand. And many of them just forget about it. And I know children with autism often have even a higher pain tolerance. So you didn't even phase them anyhow. And so when you take that approach of just kind of stepping back, when your child is acting, aggressive, and you're like, where did this come from? How do you step back and actually you're able to see him for who he is and what is happening, and not, what is actually standing before you, which is this aggressive, angry child?
To be completely honest with you, it took a lot of inner work for me to get to the point where I felt equipped enough to really help him work through that. I came from a lot of childhood trauma, a lot of abuse, a lot of emotional instability, a lot of lack of emotional intelligence. And so I was used to seeing males in an aggressive, unemotionally unstable environment or state. So with my son, when he got a little older out of those toddler years and continued those behaviors, what it ended up being for me, it was a trigger of the abuse and the things that I had went through. And I had developed a fear because, I understood one day he's going to be bigger than me. So am I going to have to experience the same thing with my son that I've experienced in the past? And so I just took the leap because, in our culture, therapy is just, I feel like people are talking about it more, but it's still one of those things. It's like, I don't really need to talk to anybody. So I took the leap and went through therapy, and it was tough and it was hard. And with that, I developed more emotional stability within myself that helped me really understand my son. I grew up to where you can't even really express your emotions, and it's seen as a weakness. And so I realized I
Seen,
didn't
not
really know.
heard, right?
Yeah.
Seen, not heard.
So I didn't know how to deal with mine, but I wanted to be seen. So I wanted my son to feel seen. So once I went through that, I did a couple of years of that. And then we ended up going through family therapy together. And I think that was a very pivotal point for us, because now I'm able to, instead of, respond out of fear, that may also look like anger, frustration, or in some forms aggression, that makes his emotional state worse. I'm able to stay in a more calm place. I'm able to set boundaries and allow him to work through those feelings. And then also acknowledge the fact that I'm his safe space. I didn't have that growing up. So I had to learn how to be that for him.
It's so important. So many children do not have a safe space. And so they lack the resiliency that they need because they don't have that person to bounce things off of. I admire you being able to go back and do the work, because I want so many parents to understand that if you don't do the work, it's very, very hard to help your child develop and be the best person that they can, because you're not able to provide that for them. And I'm a huge advocate of therapy. People kind of laugh. I feel like almost everybody needs some sort of therapy, to be honest with you, because we've all experienced, I won't say all, the majority of us have experienced some sort of traumatic experience, right, in our lives, or we all have had, failures and things throughout life. And sometimes we have great tools and we're able to deal with failure. Other times we're not. And so I think that having more of these things in our tool bag so that we're able to cope a little bit better is truly, truly important. I think your son is very fortunate, because I see, so many patients in my office who just starting with the diagnosis of autism, and the parents They have no idea. Like you said, there's just not a lot of support for some. There's, we're getting some more, things happening considering the number of children with autism now. I mean, it's just astronomical, the number of children with autism, and parents having to learn how to reparent. How do I step back and figure out ways to make sure that I'm not causing damage, right, to a very hypersensitive brain? And I try to get people to understand that. You and I give the example of just sound, right? You and I hear a loud sound and it's like, okay, but when they hear it, it's like a screeching, loud sound, for some of them. And parents don't understand, you took them to main event or something and you're trying to figure out why they're overstimulated because they hear ding, 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 boom, boom, ding, they hear all the sound. Whereas you're like, you're not listening to me. No, because I hear the bowling pins and the people eating pizza and singing happy birthday. And so I think that I wish that more parents of children with autism were able to really understand what their child is going through. Of course, you had, a medical background, which helps. But for those parents who may not have, the benefit of having this medical background, how do what resources do you feel are out there for them, or best steps that they might want to take so they can better understand?
I honestly, to be completely honest with you, I think that is a area that is still under development. I don't feel like there's a lot when it comes to that. In my experience with my clients, students, even my journey with my son, it's more of an emphasis on seeking out providers who will get the child where they need to be. I struggle quite a bit with finding that support as a parent of teaching you actually how to navigate that. That's one of the things that, with writing the book and the things that I'm doing, just with starting my business, that my emphasis is because there's just such a lack there. I found that, applied behavioral therapy and analysts, that is huge. And so it's become so huge because now parents are more reliant on those resources to help their child emotionally and behaviorally regulate. And I've just learned that that's just not enough. You have to be able to take those tools and apply it at home. And not only as a parent, but you also have to teach whoever your child is around, whether it's family, friends, or, anything like that. And that was a huge struggle area for me as well, because I was around people who didn't even want to really understand what it took, and and still wanted to treat him as the typical child, so trying to educate them and try to keep a sound mind in the process of doing that. It's just not a lot out there here in the state. There have been a few resources that I've used. There are a few sensory gyms. There's a We Rock the Spectrum gym chain that's in North Edmond or North OKC Edmond area. There's one now in Yukon, and I believe they just opened one in Norman, and they're looking at one in Enid. That has been one of the first places that I was told about that I still take my son to. That has been great because he can just go there and just be. And typically you can find those parents or caregivers where you can build those relationships and have that dialogue with them. But outside of places like that, there's really from what I found, not too much for parents when it comes to that.
And as you know, in some states they have a ton, right? Where I trained in Georgia, we had a whole Marcus Autism Institute in which we had so many different resources. But unfortunately, it's just hard for some parents to get there because of locations, things like that. And also they stay fairly booked just to the high number of children with autism and the lower numbers of professionals who can actually assist and help them. But I agree with you. I have many patients who have thrived with the ABA or applied behavioral analysis. But I also have some parents who there's some controversy around it a little bit. But I always tell people, try something. If you don't like it, you feel like it's not beneficial for your child, then you can always stop. But I've had the majority of my patients have great successes through that. And so I think that it's important. And on later episodes and things like that, we will be discussing a little bit more about dietary changes or, things that can trigger inflammation and make things worse in children with autism, because it's very important that we have these structures, but we also are dealing with their picky eating and what's going into their body. Because if you give your, like I always tell people, if you put orange juice in your car, you're just not going to function very well. So if you're putting trash, you're eating food that I consider trash, you're not going to see this high performance, which is important. But I agree, we have to improve the resources that are out there. Hopefully more individuals are willing to go into these fields. I recently met a woman who finished her certification because her son is autistic, and I actually have another woman who has 3 sons who are autistic, and she just became an occupational therapist. So one of the things I do want to let people, parents know, is even if when your child is very young and you suspect autism, go ahead and start the therapies. Meet with their pediatrician and tell them, you have these concerns, I want to start the therapies. Because about how old was your son when he started just occupational therapy or speech therapy?
He was 3. It was right after he received his formal diagnosis.
Right, right. And so, for some parents, they're like, that's pretty early. But was that early for you?
It honestly was not, and I felt like, I'm not speech therapy is not my field, so I don't know the earliest that they can actually start, but I feel like my son would have benefited prior to, because I had issues with him in childcare settings prior to his diagnosis for at least a year and a half with his behaviors and his speech. I don't he didn't really start speaking until he was really about 4 or 5, and I just thought it was ear infections.
And that's common. And they'll end up getting tubes and all these other things.
Mhm.
Not saying that it doesn't correlate, because sometimes they do have chronic fluid, but I often see that in maybe the children, oh, they'll start speaking. And so I'm one of those pediatricians who I do send them very early to speech therapy. So probably the youngest I will send is probably about 18 months, depending on how much, they can actually speak. Occupational therapy, we start 2 years old for some of these children who are especially having issues in daycare settings. But I'm sure if we ask some of the OTs and speech therapists, they probably even go lower, just those are usually the ages where we start to notice it. And so therefore we put in the referrals. But for some of these children, they may notice things even sooner. But I think that one of my main goals, for parents to understand is that when you intervene early, then you're helping their future so much more, right? Because the tools, like if you can't speak, then you're more frustrated and you're angry. And then you get in trouble more often. And then you're labeled as a troublemaker, a bad kid, etc. That's why I tell people, if your child can't speak, even if they have a hearing issue because of chronic ear infections, they still can do therapy. We still have to
Absolutely.
teach them how to speak. Right? But I get a lot of pushback sometimes where people are like, oh, they're too young for that. And so it's kind of like, I feel like a missed opportunity to intervene, because we know that the young brain before the age of 3 makes the most connections. So that's why I will send the 2-year-olds, because I'm like, man, we have a year to change the way the brain is wiring and making these connections, which will help you for a lifetime. And so I think it's really important. Now, does your son do any occupational therapy still or speech?
He does. He does occupational therapy mainly through the public school system. His speech has finally got to a monitoring status. He's been pretty much hitting those goals, but he's working on his fine motor skills with occupational therapy, his writing, which has improved quite a bit. But yeah, he's still doing a blend of both.
And I think some people don't understand autism. They don't see that it's this multi-system condition, right? And many children with autism, they're not just picky eaters. They're not just people who may not give you great eye contact or want to be bothered. Some kids love to give you hugs. So it's not this, everybody thinks a Rain Man, everyone's a savant and can count to, that's not the case. Some have learning difficulties. Many have fine motor delays or a little bit of weakness in their body. And so they may not be an athlete, right? Because, it might be a little bit more difficult for some of them. And so physical therapy, I have several patients who are also in physical therapy as well as occupational therapy, which is helping with fine motor skills, tying shoes, zipping zippers, writing. Okay. We shouldn't just say, oh, well, that'll get better. No, let's give them the tools that they need so that they can best, succeed in life. And so it's very important. And then also a lot of them have stomach issues, and so they're picky sometimes because they don't digest things the same way. A lot of them are constipated, so then constipation leads to more irritability. It's like this whole conundrum. And then they don't sleep well. Some don't sleep well because their minds are racing, and a lot of them have a little bit of anxiety, about 25%. And then you have another 25% who have ADHD as well. So it's like people don't understand, like, just because your child has autism doesn't mean that they don't need this help and this help and this help, especially with the anxiety and the ADHD I see so often with children with autism, and aggression as well. But I feel like a lot of that aggression is actually tied to, like I said, their gut issues, their diet. And so you're seeing a lot more of that because they can't communicate how they feel. And so it just leads to aggression. So I love that you and your son went to therapy. Of course, he's older, so he can communicate with you. But now you've created this space in which he can actually tell you how he feels versus just holding it in and exploding.
Yes. Yes. Yeah. And that took some doing. That took some we're still working on that. We're still working on that, but he's yes.
And
Yes.
that's going to take time, right? I mean, most
Mhm.
adults can't even master that.
That's true.
Let's be honest. So, keep that spirit, of helping him to continue to develop that resiliency. So, one of my last questions, in terms of navigating the school system, what kind of tips might you share with parents for special needs children in this case?
I would say number 1 is to make sure that you keep track of all of your documentation, and that's inclusive of your communications with the schools, but you also want to keep track of, like your medical documentation, your psych evals, things like that, because those are really what helps you with developing a plan for your child. And then try your best to be patient and understanding with the teachers to develop the most positive relationship that you can with them, because when they do not feel equipped, supported, or as confident in dealing with your child will pick up on that and it makes things a little bit worse. And then for me, what I've learned that has been the biggest, because I'm so used to, I can put on my professional hat and then mama hat sometimes gets overwhelmed. I get very overwhelmed with things. Whenever I have to address anything with the school, I always bring someone with me. And it's typically been some sort of family advocate. So I have a third party perspective. So if I'm there and I'm overwhelmed with feelings of, typically, the biggest thing with my son is his behaviors, and they get so bad where sometimes it involves injuries, multiple people, sometimes law enforcement. And so as I'm navigating those pieces and processing that, having an advocate has been great, because they can step in to just make sure that hold the school accountable for the things that they're actually supposed to be doing that I may not even think of at the time because I'm in motherland. Those are the tips, the biggest tips I would say.
That's wonderful. So we're so happy to have you on with us. Would you like to share any final words?
I just would like to thank you for the opportunity. I hope that everyone gets insight from it. My books are available on Amazon if they want to pick those up, my memoir, and then my workbook that kind of walks you through some of the things that I've learned that you can learn on your own as a parent and create for your child. I'm just grateful for the opportunity to be able to chat with you and provide my perspective. So I appreciate it.
Likewise, I truly appreciate your honesty and your willingness to share with parents and others. I feel like we should all, read a book like this because we're all going to encounter a child with autism, unless you live in some little bubble. And so, even being able to explain to our own children how to interact and how to be kind to special needs children is very important. And of course, your book talks about autism, but any child who is special needs or has behaviors that, may cause embarrassment to the family or has some aggression or things like that, this is going to help you as well and help you walk through some of those things. I'm just going to end with this. One of the great things that Dr. Abdul-Raheem shared with us was the fact that she was willing to do her own work to help her child succeed. And so I want to encourage anyone listening to think about, how much work do I need to actually do for myself so that I'm actually able to be present for my child. So with that, thank you for listening, and we hope that you enjoyed the show. Take care. Bye-bye.